Ptosis, or Ptosis is how we spell it, the P is silent, is a droopiness of the upper eyelash line. The eyelash line sits in too close approximation to the pupil or the line of sight. The eyelid should naturally rest about 1 millimeter below where the iris or colored part of the eye is at in the eye. When the lid drops too low, we have the option to elevate that eyelid through a ptosis operation. There are two main options for elevating the eyelash line. The first is called the levator aponeurosis advancement. The levator muscle is the strongest eyelid elevating muscle in the lid. It's sandwiched in the middle of the eyelid, and to approach the levator muscle, we make an incision in the natural crease of the upper eyelid and identify the muscle and tighten the muscle with a stitch. During that operation, you'll receive some sedation, and I'll give you numbing medicine in the upper eyelid to anesthetize the eyelid. I'll perform the operation, and then at one point during surgery, I sit you up to look at the height and shape of the eyelid to make certain that you can open and close your eyelid. I'll ask you to look around the room to ensure that the eyelid is in the position that I want it to be before we lay you back down and give you additional relaxing medicine through the IV. Don't be afraid during this portion of the surgery. I'll walk you through it to make certain you're nice and comfortable, but I do want you to be aware that you'll be awake during that portion of the surgery. A second option for elevating the eyelid is called a Mueller's muscle conjunctival resection. The Mueller's muscle is the muscle that sits on the back surface of the eyelid, just underneath a thin membrane that's the very back layer of your eyelid. It's the second muscle that lifts your eyelid, and we can approach that muscle as well. I typically perform this operation for patients that have a mild degree of droop in their eyelid. We evert the eyelid or turn the eyelid over, make a small incision on the back surface of the eyelid, and tighten the muscle through that incision line. You'll receive sedation through the IV to help keep you comfortable during this period of time. Naturally, after surgery, since the incision line is performed on the back surface of the eyelid, you may have some scratching and irritation of the eye in general. We'll have you use some drops and ointments to help you get through that period of time. If the scratching and irritation is really significant, we can also put a contact lens in the eye for you to wear to help you heal.